KVC Health Systems began in 1970 in Kansas City, Kansas as a project of the Junior League. After witnessing a number of children being placed in a detention center for running away or for living on the streets, a small group of women stepped forward to create a home for children and adolescents. This concern expressed for children with parents who could not or who would not care for them became a safety net cast by these women. Their initial design to help create a safer world for these children continues as the core of our mission today. In 1980, I had the privilege of picking up the legacy torch and carrying it forward. From my first day as director, when there were a total of 5 children being cared for, to today, where we are responsible for thousands of children and their families each day across a multitude of states, KVC employees have strived to create a culture that continues to pursue excellence in services to children and families. In 1987, KVC opened the first no-reject, no-eject psychiatric treatment facility in Kansas. And still today, it's the only treatment facility willing to accept all children and adolescents referred by the state of Kansas. Many other states place hundreds of children in out-of-state facilities far from their families and communities and at a tremendous cost to Medicaid and state general funds because local providers won't accept them. In 1992, KVC expanded to open its first psychiatric hospital in Kansas, specifically built for children and adolescents, and like our psychiatric treatment facility, we accepted every referral made by state employees and mental health center employees. Today, KVC psychiatric hospitals and inpatient treatment centers coordinate care for children needing intensive treatment for stabilization and work with caregivers to create an effective plan for continuing treatment in their homes and communities. Knowing that children grow best in families, over the years, KVC became more and more adept at supporting community families managing even the most challenging behaviors, and KVC moved away from the original group home concept. In 1996, the state of Kansas became the first state to privatize child welfare services, including family preservation, foster care, and adoption services. KVC was one of the original contractors to help pioneer the transferring of case management services from the state, and KVC staff across the nation work hard to continually identify, train, and support birth, relative, foster, and adoptive families as treatment partners for children, often legally identified as children in need of care. As of July 1, 2013, KVC began managing, in cooperation with the Department for Children and Families, 30 counties in eastern Kansas, representing 50% of all family preservation, foster care, and adoption services in Kansas. Because of our long history of success in Kansas, KVC routinely is approached by various state governments and welfare organizations for consultation, training, and development of child welfare and behavioral health care services in their states. Currently, KVC provides services to children and families in Kansas, Nebraska, Missouri, West Virginia, and Kentucky, and has a contract with the Department of Children and Family Services in Washington, D.C. to provide leadership in reducing the number of children in foster care and to implement trauma systems therapy throughout the entire system. We are the largest provider of foster care and home-based family therapy in Nebraska, the largest provider of foster care and home-based therapy in West Virginia, and the largest provider of family preservation services in Kentucky. KVC staff have attained successful outcomes in regards to keeping children safe at home and out of foster care, safely in care, helping them to return safely and quickly to a permanent family, and to improving their overall well-being. KVC has been named a National Best Practice Organization by the Annie E. Casey Foundation, and KVC has also partnered with respected researchers such as Dr. Glenn Sachs, Chair of the Department of Child and Adolescent Psychiatry and Director of the NYU Children's Research Center. Results of the partnership include staff and resource families being trained in trauma systems therapy, as well as the development of the NYU KVC Midwest Trauma Training Center. As we remain on course to change the face of foster care and improve behavioral health care, we will continue to create innovations to raise the bar in quality, knowing there is no magic answer down the street. We are passionate about excellence in serving children and families, and hope you will join us on our important mission. Thank you.